Good evening. It's Pastor Gary Cuthbert here in Ajax. This evening I would like the opportunity to address about housing, education, public transportation, and employment, as well as agencies and programs. Plus, I cannot forget about health care. Going back to number one, housing. There are houses being built in the Durham region area and surrounding areas that are not affordable for the typical working family. In these times, we are seeing more and more that the wife and husband have one or both have two jobs just to exist, and it's even more so of a struggle for those that have children that is coming up and going to school and going into high school. And also, there isn't enough affordable housing for the elderly as well as the physically disabled, and there's not enough adequate housing for the mental patients that are coming out of Lakeshore Hospital in Whitby to go into group homes. We must come together and start doing something regarding this issue. Regarding the education, I believe that the education system is somewhat good, but it's not practical and beneficial for a lot of our students in the intuition fees for education in our high schools and our colleges and university is outrageous. These students start off with the bill before they have their feet wet in the field of their choice or of their education that they've gone to school for. Now, getting to the public transportation situation here in Durham region, for a number of years we have heard our city officials and politicians for the area say that we must start taking public transportation. But what I'm seeing from being out in the streets and an evangelist and working with the homeless and needy through my region is that there are many people that would love to take public transportation, but in many cases the public transportation isn't adequate. And then now they are talking about during my region public transportation, taking a bus off of Roslyn Road. Now, I have and know of people that work and live in the Oshawa area, and they're either working in Oshawa or they're living in Oshawa and working here in the Ajax Pickering area, and it's going to make it very difficult for transportation in that regard. And something definitely has to be done, and we have to make our city officials that are elected representing us, as well as our local politicians and the provincial and federal government aware, and to be able to do something in regards to employment. First of all, in my personal opinion, and from what I'm hearing from individuals through the streets of Durham, my region, is that number one, if there is any employment, it is at minimum wage, and in many cases there isn't benefits, and this doesn't help people that are wanting to have a family and or other people that have families. And the thing is that once again transportation comes in to this. In order to get work, you have to travel further to make ends meet. And from talking with recipients and people that I have in the streets, they are working, but they are not even living. They are just existing. In many cases, they are working to work. And also regarding nursing homes and this PSW caregivers that are going around. It's impossible for these people, in many cases, due to the volume of traffic and the distance that they have to travel from one client to the next to be at the client's residence within 15 minutes, especially at certain times of the day, and with the volume of traffic. That's something it needs to be addressed in. These coordinators that are scheduling and making, they need to have some accountability and have some common sense of what it's like if they've never been outside the office. And I've been in traffic, especially when it's a peak volume of traffic early in the morning and between 2 and 6 in the evening. And it can vary at various times during the winter month. Regarding agencies and programs that are currently in place here under the umbrella of Durham Region, in my personal opinion, you have Ontario Works and you have Ontario Disability Support Program, and you have other programs that are supposedly in existence and supposed to be doing something for the less fortunate and for those who aren't as fortunate as others. In my personal opinion, these agencies have some type of funding, whether it's private or through the government, and in my honest opinion, a lot of them are over excelled. They are thinking of putting money in their pocket, and a lot of people that I have talked to are slipping through the cracks very rapidly. And the thing is that these agencies, especially the Ontario Works and Ontario Disability and other health agencies, such as Durham Mental Health, all these agencies need to be overhauled to handle the vast majority of recipients that they are looking for. Now, also, I'm aware of some situations that, in some cases, that certain clients were promised this and promised that, and when the agency got set up and that was getting people involved due to other circumstances, they were put on the back burner, and when recipients thought they were talking to other recipients in the building, it was found out that they were talking to other people in other buildings. Now, if the agency doesn't have adequate staff to handle the volume, they shouldn't be making promises. And number one is that if you are dealing with somebody that requires a PSW, and you're dealing with somebody that is mentally challenged, these are two different categories and two different circumstances, and I believe that there should be more training, and they should have some more knowledge and accountability of what they are doing. And the big thing is sticking out like a sore thumb. A good portion of these people in agencies and other typical existing programs, as well as in the PSW and healthcare system, a good portion of them are there for a paycheck, and they do not care really about the recipient that is required. I personally have had some incidents in this regards, and the thing is, these people in the agency, in the staff of the agency, in the office, in management, in the CEO and executives of the agency, have to realize if it wasn't for disabled or elderly people or people that are mentally challenged, these workers would not have a job, and these people that started the agency and executives and CEOs, they wouldn't be having a paycheck coming in. So they need to tone down and get back to reality and start taking a better look and care of other clients. And it should be structured where there is more people coming in to the recipients to see what's needed when if there's any significant change, because once again people are being slipped through the cracks, and the caseworkers, I believe, are overburdened and have a volume of people to look after that they can't handle in that regards. Once again, this is Pastor Gary Cuthbert here in Ajax. And also, please remember, I am a member of the People's Political Party, and we are going to make some changes, and we need you to bring your stories and your situations to us so that we have ammunition to take to the current elected city officials and or elected provincial and federal politicians in our area, so that we can get them doing something, and so that we can have things the way it's needed to be and not be put on back burners. Once again, thank you.